Do you or someone you know have problems sleeping, sleep issues? Well, you may not realize that they are tied to your ear, nose, and throat. Well, we're talking today to Dr. Vincent Pisciotta, who is the ear, nose, and throat specialist here on the Mississippi Gulf Coast, working with Singing River Gulfport Services here. Dr. Pisciotta, it's good to see you.
Same here, how are you?
I'm doing well, thank you. Give us a little background about yourself first, if you would, please.
I've been here since 1997, did ENT, ear, nose, and throat, and also do a lot of sleep work, board certified in both. Have done 15, 20 years of sleep medicine along the way, and it's a growing specialty with a lot of ramifications for especially the 30 and 40-year-old overweight population. Our population lives large now, so.
Unfortunately, Mississippi #1 in that area of being overweight or obesity in the country. So I'm sure you see a lot of it. I mean, what's really exciting about the world of sleep medicine?
The biggest thing is that, if you, on a morbid note, if you look at the obituaries and see people in the 30s and 40s that have passed away, most of those are from sleep apnea. Reggie White died of sleep apnea. So the quality of life is a significant problem. A lot of people with AFib or diabetes and high blood pressure, all those are related to bad sleep. So what we do as an ear, nose, and throat, for me, the fortunate thing, it's not all just about putting somebody on a CPAP machine. There are multiple parameters, dental appliances.
And I think that's one of the things that a lot of people fear, that I'm going to have to spend the rest of my life with one of these things over my face trying to sleep at night.
Right, and that success is probably 50%, right? So depending on how bad the severity is, there are other options, surgery, dental appliances, et cetera. So, there are people out there that stop breathing over 30 times per hour. Over 30 is considered severe.
Wow.
I got people that stop breathing 90 times an hour. The people less than 30, they have multiple options for resolution. It's become a big deal right now with the Department of Transportation. A man with a neck size over 17.5 inches is likely has sleep apnea, right?
Okay, because I'm right at 17.5-inch neck, so.
Right. So, for instance, my weight right now is 180, right? At 5'11", I should be 178 or less. So I am 2 pounds overweight. Now, my weight range should be 152 to 178. So a lot of people want to argue the obesity, overweight, but just medically speaking, obesity has a lot to do with it. There's a lot of connections with AFib and high blood pressure and diabetes resistance and multiple antihypertensives.
So I feel like right now that I'm a good candidate for a study because I'm almost 6 feet tall, 5'11" and a half.
Right.
Weigh 208 pounds.
Right.
I do have high blood pressure.
Right.
And I'm 64 years old.
Yeah. Anybody complain about the way you sleep, snoring?
Yes. Sometimes. It depends on how I lay. Sometimes, if I go to sleep, sometimes I'll snore.
Right.
Sometimes I won't.
Right. So right, you would be a candidate for a sleep study.
Okay, so.
Right, so there are options for that. There are in-lab studies or in-home studies now, right? So they're readily available. Insurance covers it. The Department of Transportation, I see people all the time that are required to have sleep studies to keep their job, to keep their DOT license.
Truck drivers and things like that.
Yeah.
And I can understand why, because
Right.
I mean, you fall asleep driving one of these, multi-thousand-pound machines, and it could cause a lot of problems.
Tugboat captains, airline pilots, all those are issues. So just a big note would be, I don't really expect your apnea index to be over 30, right? Because
No, it's not.
But which would be severe. But a big note for me in patients that are in their 30s and 40s, right, that have an index over 30, they stop breathing more than 30 times per hour. In their 30s and 40s, their risk of not waking up in the morning, having something called sudden death, a major heart attack in their sleep and not waking up in the morning, is 70% higher than normal.
And I have a dear friend that passed away just from that a couple of Christmases ago.
Right.
Same thing, overweight, and he didn't wake up.
Right. So there are ways to help, the CPAP, there are other options, right?
Talk about some surgical options.
Surgical options, a lot of times, so a major surgical option, most of apnea, where ENT plays a part, is it's basically from your nose to here. If I put a trach in a patient, then air goes straight into their lungs, so they no longer have sleep apnea, unless they have some brain issues, central sleep apnea, some other variants. So it's usually between the tip of your nose and your larynx, where you have kids have large tonsils. They snore bad. It's usually tonsils for the younger populations. Deviated septums, your palate, the back of your tongue. Your palate rattles or your tongue, right? So not to be dramatic, but all those things.
When you sleep or normally, even when you're not asleep.
That's right. So the weight issue is that it begins to constrict the airway. It's like, I tell people, it's like stepping on a water hose, right? The more you weigh, the water gets constricted. Right?
Yeah.
So what happens with blood pressure stuff is like if I were to put a pillow over your face, right? Your oxygen level drops, your blood pressure goes up, your heart rate goes up, and eventually you start having, additional exacerbations of coronary artery disease, cholesterol, insulin resistance, all those things.
High cholesterol also to contribute to this?
Yeah, and there's a range from chronic fatigue patients. There's excessive daytime somnolence. I mean, I had a patient that was so bad that he fell asleep driving his dozer and ran through a barn. Right? Then he came back and decided to do something.
I would hope so.
But it wasn't until that, right?
Yeah. So, I mean, I guess if a person has any of these symptoms or issues or whatever, the best thing that they need to do is call your office and make an appointment.
Yeah, and talk to your family practice people. I mean, their availability, multiple levels of availability to get access.
Right. So they need to talk to family practice, and then they'll.
No, we'll be happy to see them. They can see.
Right.
But
do they need a referral?
Depends on the insurance, but
Gotcha.
I don't consider that they need a referral. But if they see a nurse practitioner, a family doctor, all these things they should be aware of.
Okay. We've got about a minute left. So, is there any other issues that that people should be aware of? Or wondering do I need a sleep study? Because they probably think, well, I've seen pictures of it. They hook you up with all these wires and all that. So
some of it's uncomfortable, right? And so the people that have comorbidities, people that have high blood pressure, diabetes, multiple MIs, cardiac stents. You got a 50-year-old that had stents. They should all have sleep studies, and those should be sort of in-lab studies. There are home studies where someone like myself or you that don't have a lot of other medical issues are reasonable to do at home. The home studies I don't like as much because you don't get as much information, so I can't be as there's not as much information that I can give you on a home study.
Right.
So, having said that, there's a realm of access.
Right.
Yeah.
Okay. Well, if Dr. Pisciotta, thank you so much for your time.
Appreciate your time.
Appreciate that very much. Very educational. If you'd like some more information about that, phone number is on your screen. You can give them a call for you and a loved one. I mean, it could really make the difference between life and death. So give them a call and get a sleep study done. Sing River Health System.